Well, good afternoon, everyone. Thanks for joining us today. We are at the 3 o'clock hour, so I'm going to go ahead and get started. On behalf of the Family Center and everyone on the slide, I really just wanted to thank you for joining us today. We're excited to have a really robust discussion about telegenetics and also really look at some of the perspectives from both providers as well as families today. I did want to acknowledge before we get started that we at the Family Center are funded by a grant from the Health Resources and Services Administration, or HRSA. So I just wanted to point that out on the first slide here. So a couple housekeeping points I wanted to cover before we get started. The webinar is scheduled to last 1 hour this afternoon, including time for a question and answer at the end. I'm going to go through and mute all the participants so that we can present without interruption. The webinar is going to be recorded and will be sent via email along with the slides, the infographic, and a brief evaluation survey after the presentation, as well as some references that will include the resources that we're going to be sharing today for you all to go look at those as well. And for the purposes of the Q&A, you can submit your questions through the chat function at any time during the presentation. Like I said, we'll have a dedicated time to answer those questions at the end. We're really going to hope to get to all of them today, but in the case that we run over time, we'll certainly be prepared to follow up on any questions that we don't get to today or aren't able to answer today. And if there's anyone that, for any questions that might be more suited to a voice question, you can raise your hand or let me know in the chat and I can work on unmuting folks for that when we get to that point. So as far as our agenda for this afternoon, I'm going to run through a quick introduction to the Family Center, provide an overview of telegenetics and what that is, share our TeleWhat infographic, which we're really excited to be releasing. It was something that the Family Center and some of the family representatives that we work with just developed and have released in the last couple of weeks. We'll also share some telegenetics and telehealth resources, mostly for families, but we also wanted to point out some for providers as well. And then we'll move on to a panel discussion, really looking at the provider perspectives of what families need to know about telegenetics, as well as the family leaders' perspectives, and then open it up for question and answer. So I firstly wanted to highlight the National Genetics Education and Family Support Center, or the Family Center. The Family Center is actually made up of the 3 organizations you can see right here, Genetic Alliance, Family Voices, and Parent to Parent USA, really groups that are already working to support patients and families around the community. It's a 3-year project that's funded through May of 2020. And the key functions or activities that we do are really aimed around helping families develop the skills to partner with professionals and improve systems of care. We help the regional genetics networks partner with families and family-led organizations. We assist with outreach to diverse and medically underserved families and provide education and support. A couple ways that we do this specifically: we have trainings that we provide. We conduct and help technically assist the regions. We maintain and promote online resources like diseaseinfosearch.org, genesinlife.org, and the Advocacy Atlas. We support partnerships between family-led organizations, the National Coordinating Center, and the Regional Genetics Network here at the Family Center as well. Now I'm going to jump right into an overview of telegenetics. So let's quickly start before we discuss telegenetics, but what telemedicine is. So I really want to highlight that definition first. And really, telemedicine or telehealth is the use of technology to improve the healthcare system, including connecting patients in one location to providers in another location. And a telegenetics visit is similar to an in-person genetics clinic visit. However, you or your family member will use technology, such as a video conference with a computer, phone, or tablet, from a provider's office near you, in your own home, or potentially even another location, such as a school, to connect with a genetic specialist that's located somewhere else for a clinic visit. And while video conferencing is often what takes place, there are a few other methods through which this can take place. So video conferencing is live two-way interaction between a person and a provider using an electronic platform similar to Skype or FaceTime, maybe even Zoom, like the platform we're on today. Store and Forward is where you'd receive an evaluation and treatment recommendations from a genetic specialist based on pre-recorded health history that you've prepared with your child or your primary provider. Remote monitoring would be where a local provider monitors your child's health status and behaviors and transfers information to a genetic specialist to assist in providing care to you or your child. And then mobile health is where you would exchange text messages or video conferencing with a genetics provider through a secure application on your mobile device. And again, these are really just rough definitions, and we'll be discussing this a little bit more in depth on the panel today if people have questions or want to learn more about that. So how does a live conferencing visit work? The specific things that happen during a telegenetics appointment or a telegenetics visit really depend on why you or your family member were referred for genetic services and whether this is your first time having a genetics appointment or whether it's a follow-up appointment. So for example, you may discuss test results or maybe just having a check-in, one of your regular check-ins with your provider. Typically, an appointment will last 30 to 60 minutes. The provider will use these appointments to collect medical history and family history. Sometimes local providers will help in the case of physical exam. And the provider may share recommendations for follow-up, which can include testing options. There will be situations where genetic testing isn't offered at the visit and where other types of follow-up will be recommended. So that really just depends on your specific appointment and situation. So why is telegenetics appointment? Really, we wanted to talk through some of the benefits of telegenetics and show how this is helping to reduce barriers. Really, the ability to have remote appointments improves access to genetic services. Specifically, in terms of barriers, we see that telegenetics can reduce common ones such as distance, time, ability or a need for childcare, mobility challenges, transportation, but also bring significant benefits to families, which include less distance to travel, less cost, potentially time savings, increased number of available providers, more access to early detection, and even increased patient satisfaction. Now, I want to highlight the infographic that we have developed, as I mentioned, along with our two family leaders that you're going to be hearing from here shortly, and they'll talk a little bit more about the planning and kind of the impetus for this project here. But this was a new infographic that I wanted just to really showcase today, and we'll be sharing this via email along with the slides after this presentation. But we really thought it would be helpful to show how some different kinds of stakeholders would be able to utilize this. So individuals and families, you can use this to learn about telegenetics, to prepare for your appointment, and also share with other families that you might feel could benefit from this information. For providers, you can share this information with telegenetics patients. Also share with other providers who might find this useful for their practice. And then for our advocacy support organization partners, you can disseminate the infographic to families, you can share the infographic on social media, and even upload the infographic to your website. And we're happy to help you do that if you need any support or guidance there. And as I mentioned, we're going to be sharing the PDF with everyone, so hopefully this will get some great use. Encourage people to print it out, put it on your websites, and share it as much as you'd like. So in an effort to not recreate the wheel, we wanted to also share some highlights of community resources that really provide more information about telegenetics and telehealth. We also included some COVID-19 resources that relate to telemedicine and telegenetics, knowing that this is really timely at this moment. This list is by no means comprehensive, but there are resource repositories and sites that are being updated regularly, and also a few directories that link to other resources based on your region or your state or local area. And we'll also include these links and resources in what we disseminate after the meeting today. So first I wanted to point out one of the regional genetics networks Midwest has created an animated video series as well as a patient interview compilation. The animated video series is a 3-part series that introduces you to telemedicine, describes what to expect, and can help you get the most out of your telemedicine appointment. The other video shares experience of 4 families that use telehealth to receive care for a child with a special healthcare need. Their family members share doubts, fears, and triumphs related to their experience with telehealth. And the video concludes with family members offering their support for considering telehealth as a safe, effective, and convenient way to receive healthcare. So really encourage you to check these videos out, which again will be linked in the materials that we share after this meeting. The Western States Regional Genetics Network has also developed a video for families. And this video provides information on what to expect from a telegenetics video in your home. Another family resource that we wanted to point out is this Telehealth for Consumers infographic that was developed by the Center for Connected Healthcare Policy, or Center for Connected Health Policy, excuse me. The infographic explores telehealth and highlights some of the potential benefits for consumers. Now, in terms of COVID-19 response resources, with all that's going on with COVID-19 at the moment, we wanted to share 2 resources that were specifically developed in response to the crisis. The National Coordinating Center for the Regional Genetics Networks, which is housed within the American College of Medical Genetics and Genomics, that's a partner to this project, has put together some other resources from the regional genetics networks and other project partners, such as Family Voices, who have COVID-19 response information on their website. The National Consortium of Telehealth Resource Centers has also put together a toolkit to share information on what telehealth is, how it can be used in response to COVID-19, and how telehealth has helped in past pandemic incidences, and also shares helpful resources. So we'll be sharing that as well. Encourage everyone to take a look at those great directories. And along those lines, we wanted to highlight 2 of the regional genetics networks that also created COVID-19 response resources specific to telehealth or telemedicine. So Mountain States Regional Genetics Network, they're on the right, and Western States Regional Genetics Network on the left have both updated their websites with special sections related to telehealth and the COVID-19 response. So encourage you to check out those websites, which again will be linked in the materials that we share. So we also wanted to highlight the National Consortium of Telehealth Resource Centers. The telehealth resource centers have been established to provide assistance, education, and information to organizations and individuals who are actively providing or interested in providing healthcare at a distance. I've got a couple resources to share, but just wanted to point out how they've also been divided and have regional resources available as well for anyone who's interested. So there was a document recently developed by the Telehealth Resource Centers. This provides some answers to patient questions around telehealth, such as how can I start receiving telehealth services? What equipment do I need? Is my personal health information safe? And can I trust the telehealth doctor? We also wanted to provide just a highlight of the provider materials that they develop. And this is a provider-focused infographic that the Telehealth Resource Centers have developed that's really sharing information about the technology, licensing, and reimbursement considerations for telehealth. We know in addition to families having a lot of questions, providers have also had a lot of questions about telehealth recently, so wanted to point out some of the resources that are available as well. So I'm going to hand things off now to my colleague, Alissa, who is going to introduce our panel here today.
Thank you, Joel. So I'm Alissa Ware. I'm a program manager with Family Voices. And so we're going to get started with a panel of providers to cover the provider perspective of what families really need to know. And so just starting out, the 2 providers that we'll have on the call are Dr. Joann Bodurtha, who is a professor of genetic medicine at Johns Hopkins University. She's also the program manager for the NIMAC Regional Genetic Network. And we also have Alissa Terry with us, who is a genetic counselor, as well as with the NIMAC Regional Genetic Network. So thank you both for participating and joining us. I want to start off with sharing that these questions were actually developed by families of things that they felt like, you know, not only what they want to know, but other families need to know concerning telegenetics. And so Dr. Bodurtha certainly, and Alissa certainly, as we have developed this webinar, we've also come into the midst of the COVID-19 pandemic. So if you want to expand your answers to these questions based on kind of what happened before the pandemic and then what happened afterwards, that would be fantastic. So just starting out and really wanting to know, how do you reach families? How do families know telegenetics is available through their provider? You know, what strategies and techniques do you all use?
Sure. Well, thanks for including us here. I had the privilege of being in Virginia for many years, and we did lots of telegenetics through health departments, some rural hospitals, and believe it or not, through the prisons and all. Maryland has, I would say, more individual center-specific systems. And for example, I was doing telegenetic services with one of the Chesapeake Healthcare, actually, on the Eastern Shore, where patients from that area came there and saved, you know, the 2.5-hour trip and the trip across the bridge to come. And other places in Maryland and in our general region may have specific telegenetics clinics that to date have, for the most part, operated, you know, with people coming to specific centers. That's not to say, and Alissa can talk more about this because I'll finish my both before and after COVID mention of things. Other places certainly do have existing systems where, you know, for example, at discharge of hospital, they may, if somebody goes out of state, have a telehealth resource to do kind of their planning at home and this sort of thing across the region. But those have been individual. I would say what has happened since COVID and all has been many places, genetic centers, because we have not only existing patients, but particularly the influx of either critically ill patients or critical newborn screens have tried, but again, I can't speak for every place, to make telehealth, telegenetics visits available, and yet at the same time, triage if people still need to come in. Here at Hopkins, we have actually quite good and separated sort of COVID pathways and non-COVID pathways. And so we are still seeing in person, you know, any of the critical newborn screens or anybody with emergent metabolic, you know, diseases in person, I think safely by having, you know, 2 tracks and really screening people to go in the right track if they are symptomatic. The Hopkins website has the self-COVID checker that I encourage everybody to look at. You can get that online otherwise through the CDC. And what we've done over the past 3 weeks or so is convert slightly more than half of our upcoming visits to telegenetics visits. So if you are a scheduled patient up through May, we've rearranged those visits. Some of those can be put off, and it's family's desire to put them off. So what we do when we call is offer people a choice. I would say most people are not choosing to come in, and we're trying to minimize those visits for those that, you know, are really urgent. And we are certainly, with our visits, arranging for genetic testing by sending kits to home. And non-urgent patients, we are putting off the scheduling of in-person visits kind of to the end of August and September, but trying not to have that wait be too long and see if we can fit in some new visits. But I would say I'm not speaking for every other genetic center at this point, but we have, you know, we have office staff who are here, typically, you know, reduced staff, but they're taking voicemails and we're calling people back, and our processes at some level here at Hopkins are not that different with the substitution of the telegenetics calls. And I can, again, speak more to that, but I want to hear from Alissa.
Yep. Thank you, Joann.
Yeah, thanks, Joann. I guess when I read the question, how do we reach families, I think it's important to think about the fact that the whole concept of telemedicine and telegenetics is about trying to reach families that have challenges coming to clinic. So sometimes we at least like to imagine that the availability of these telegenetics clinics is meaning patients are coming to clinics that never would have come otherwise. I think every clinic tries to serve the patients in a place that's more convenient than the original clinic setting. So sometimes that means the patients are talking to the provider from home, but not always. That's more common now than it used to be. Sometimes it means that they're coming somewhere like a community health center or a school, but the bottom line is to try to make it a location that's making things easier on the family. Mm-hmm. It definitely is an issue that even if a telegenetics clinic is in existence, that doesn't mean that the families know it's there. There's been different efforts that I have seen for these clinics to try to let the communities know that it's happening. So sometimes there are purposeful marketing campaigns basically to the referring providers. So, oftentimes the primary care providers in the community, to let them know that this is a new opportunity, that they can be referring their patients to this type of clinic. Sometimes there is outreach to families, through things like Facebook campaigns or something to let families know that telegenetics might be available to them. And I think sometimes it really depends on how much telehealth the system is doing. So if it's a big hospital system and there's a huge telemedicine push for the whole system, there's probably more money in pushing that information out, both to those referring providers and to the patients in the community to let them know that it's out there. So we've seen some of that. Now, what's happening in the past month is different. As Joann said, things are very different at Hopkins now than they were a few weeks ago, and I can safely say that that's true pretty much across the board for every genetics clinic in our region. I've probably heard from over 50 of our regional genetics providers in the past month saying that they are implementing or expanding, if they already were doing it, their telegenetics offering. So usually for every patient that was on the schedule, they're getting some sort of phone call, text message, communication of some sort that their appointment can be done by telemedicine if that's feasible. Mm. As Joann said, there are certain patients that still probably need to come to clinic. So that somebody is responsible for sort of putting those patients in different categories about whether or not they're going to get that offer of a telemedicine visit. So we're seeing that pretty much everywhere. I can say that one of the things that our regional genetics network was doing over the past few years, we had a phone line, a free phone line, where either families or referring providers could call to find genetics providers for the family or for the person they wanted to refer, and that included the availability of telegenetics options. So that was sort of the effort that we had made to try to make sure that if a family was calling or a referring provider was calling, they knew that that was on the table in terms of options. What this is going to look like 6 months to a year from now in terms of the number of genetics clinics that will retain telegenetics as one of their methods of care. And I think there's just going to be a huge shift in all of us. Probably a lot of us are going to experience telemedicine in one shape or another in the next 6 months, and we're all going to know now that it's an option. So I think that community awareness has forever changed, and families are going to start asking more, I would guess.
Right. Well, thank you, Alissa. You know, kind of to the point that you made, Joann, and Alissa as well, there's, even before COVID-19, there seemed to be a little bit of uncertainty among families about kind of how do they access telegenetics. Is it available? Is it not? And some of that is still existing as, you know, the rapid changes with COVID-19. And so we were curious about, how do you feel with the rollout of the TeleWhat infographic that's really for families to really understand what telegenetics is and how it operates? How do you think that it could potentially help you to reach and serve families? So, and whichever one of you wants to start.
Yeah, I'll go ahead. I mean, I think right now, and there are, you know, others on the panel who can also speak to this, we are trying to use a platform called Polycom, because it hooks into our electronic record system, and it's a way to be HIPAA compliant and all the rest of that. None of our sessions are retained or recorded, and again, I think there's a lot of attention to doing this in the best possible way. But if people don't have bandwidth in rural areas and can sometimes have trouble with the sign-up piece, although we've streamlined that as well. We do have kind of on the fly backup things. So we certainly have done some telephone visits. We've moved to Zoom. We've done parts of things on FaceTime, et cetera. Those are not preferred in a sense. And I guess my concern, just hoping this, you know, we get back to more choices for people, and including telehealth and among those choices, are that we, you know that people who don't have bandwidth may have fewer resources, you know, don't have lots of minutes on their phone, may speak other languages, you know, can find parts of this more daunting.
Mm-hmm.
So I think that is still out there as a strong concern that we have. But from a point of view of follow-up with patients, you know, well, I mean, you know, when I do a telehealth visit, again, you know, I can't get the height and weight except by asking. I don't have somebody there if they're at home, but, and there are certain parts of the exam, because we did not, for example, for our health center clinics, gear up with the kind, I mean, you can do things like get ultrasound machines that do technologically, and you can get stethoscopes and blood pressure cuffs and sort of go the high tech end. And we have not elected, and had not elected prior to COVID, to go that route. So there are limitations for some aspects of things, but if you have a family that, I tease that, you know, if they have a flashlight or a lamp, along with a computer or laptop or tablet, we can usually figure out a lot of the exam, but I don't have the capacity to listen to a heart or palpate an abdomen,
Right.
look at the skin pretty well, et cetera. So there can be limitations, and you know, you need to head into it saying, you know, this is collaborative. I'm going to need mom or dad's help maybe a little bit more than I might in terms of, you know, looking at various body parts, but it really can work very well. And again, you know, you want to have the ongoing shared decision making about whether testing makes sense at this, or whether people want to get back in touch, et cetera. But it isn't, I don't want to, it feels different, no question. But once people get comfortable, particularly for your follow-up patients, it doesn't feel any different than you might be FaceTiming with your family from the provider's end.
Right.
New patients sort of establishing rapport electronically can be seem one-sided sometimes.
Mm-hmm. So Joann, I just want to follow up on one thing that you said, and you know, you kind of raised the point about there are different things that can happen, and so we know that especially in this time right now, you know, how are you reaching families that don't speak English? And so I'm just really curious about, and certainly after you answer, Joann, from, you know, your experience at Hopkins, Alissa, if you can answer from your experience just with, talking to genetic providers across your region, what happens if a family requires an interpreter within a telegenetics appointment?
Right. So again, if we're using the Polycom platform, we can have up to 6 people on a call. And so even, so you get an interpreter for scheduling or contacting the family ahead if we're rescheduling a visit or needing to schedule. And then we, would set up if we need an interpreter. That interpreter is part of the call, so they join the visit. A very quick story of a semi-success is we had a mom, this was in the first week, who spoke Arabic. And again, nobody had realized that the instructions that, we just hadn't thought that far ahead. The instructions she got weren't in Arabic and all, and just had not managed to be in touch with the interpreter. But what she did manage to do, and we managed to do, because we have the interpreter on, is do the visit by phone. And then she actually texted, or not texted, but sent us pictures to my chart from her phone. And we actually had this very satisfactory visit. People, I think, are trying to be quite flexible right now. But again, I'm coming in a fairly large system where, we really take the need for interpreters very seriously and try to arrange that. When I was doing it in the clinic, prior to COVID, they would have interpreters at the clinic office there. So we take this very seriously, but it is not necessarily easy for every place to put this in place kind of on the fly.
Okay. Thank you, Joann. Alissa, how about you?
Yeah, Joann described a couple of different methods that can happen. So sometimes during a video conference like this, you can have the genetics provider on the screen and the patient on the screen and the interpreter on the screen. So you can have 3 people or more physically viewable on the screen at the same time. So that's one option. Sometimes the interpreter might be sitting with the provider. So if Joann's at Johns Hopkins, there could be an interpreter sitting right next to her. So the 2 of them are together, and then the patient
6 feet away, 6 feet away. 6 feet away.
Yes, yes. I didn't mean right now, but yes. If the patient is coming into another clinical setting, like a community health center or their primary care provider's office, theoretically there could be an interpreter physically there with them. There are also times where the interpreter will come into the call and only be on audio. So they will not be viewable on the screen, but they'll be calling in to provide the interpretation. And I've seen all versions of that.
Okay.
We definitely have seen issues previously with some of the interpretation services that were designed to be virtual. So they were set up to be done over video conferencing, but not necessarily set up to integrate into an existing video conferencing system. So they were designed thinking that the patient and the provider would be physically together in the same place, and that the interpreter would be the only one coming in by video conference. So now that we're trying to integrate those virtual interpreter services with the fact that the patient and the provider are also using video services and making those different video services work together, that's the challenge. And I would guess that that's a challenge that's being solved quite quickly over the past few weeks, I hope.
Right. Well, thank you, Alissa. With just a minute or 2 that we have left, I see the questions in the chat. We'll have time for we'll field as many of those as we can at the end of the webinar. But with the final minute or 2 that we have left, what is on the minds of many families is, will my insurance cover it, or how much will it cost me? And so can each of you kind of touch on that and what that looks like for families right now?
Yeah, I mean, I would say generally, yes, that, and again, I can't speak to every state and all, but we basically had codes for telehealth previously. We actually now have phone codes, and I think there has been particularly at the federal level, a recognition that this is the best care right now in many circumstances, not to have people, again even if they didn't have long transportation issues previously, but the best possible way now to safely deliver care with the social distancing and not traveling and all the rest. So, for those right now, I don't want to say I would not worry about insurance, because we should all be concerned in these times of economic constraint. But yes, these are billed as insurance visits and all. I think people who are losing their insurance now, I think that's a challenge and all as well. So I don't in any way mean to be
Right.
casual about this aspect, but a lot of attention was paid to making sure that there was coverage in this arena. Alissa?
Yeah, I agree. I would say most usually the costs are similar or less to in-person care. Usually the telegenetics clinic that's setting up your appointment will have some sense of whether your insurance is going to cover it. There are different, so there's sort of a whole bucket of previous insurance regulations about who cannot receive telehealth and under what circumstances and in what setting, and none of that's true anymore. Yeah. So there's a whole new set of rules that we're playing by now, which is great because all these people are receiving telehealth services that never did before, and we have no idea what it's going to look like in a year. Yeah. So I'd like to hope that a lot of these changes are going to prove themselves to be so beneficial to the patients in the healthcare system that they're going to be retained, and that we can all fight for them to be retained.
Okay.
All right. Yeah, coverage is decent. I'll say that.
That's good. That's good. That is promising to hear. And like you, I share your sentiment that I hope that there are some things that we take into post-COVID-19 times that I think increase access for families to providers. So I want to thank you, Joann, and thank you, Alissa. We will be tapping you for some questions at the end. Sure. Some of your commentary has sparked some questions in our comments, so we will follow up. But right now we are going to shift to our parent panel. And so we have Ashley Bates Crowley. She's a family leader that resides in Kansas. She helped to co-develop the infographic that you saw, the Telegenetics infographic, and also is a member of the National Genetics Education and Family Support Center. We also have Alisa Bentley, who's a family leader from South Carolina. As well, she helped co-develop the Telegenetics infographic and sits on the Telegenetics work group as well, and is also a part of the National Genetics Education and Family Support Center. So welcome, Alisa and Ashley. And so similar to my conversation with Joann and Alissa, I have some questions and just want to really start out with, because I had the opportunity to work with you all to develop the infographic, and you both opened my eyes to so many things that I want you to share with other families and participants. And so first, really wanting to understand, how did you personally find out about telegenetics to help with your children?
So for me personally, so my daughter is 11 and has a rare chromosome disorder called MBD5 associated neurodevelopmental disorder. It was previously known as 2q23.1 microdeletion syndrome. So for us, 11 years ago, there wasn't a lot of information. There are still less than 300 cases of what Madeline has documented in the world. So for us, it was really more about access to quality healthcare. We were fortunate enough to be linked to our local genetics center, Greenwood Genetics here in South Carolina. They were helpful in getting us our initial diagnosis and leading us in the right direction of what needs to happen for Madeline. But the more we started to discover about her genetic disorder, we realized that we really needed to broaden our scope on providers. For us, travel, especially with her and her condition, is not something that is easy for us to do. While we do have access to amazing providers in South Carolina, we're right over the border of North Carolina, so we have to access amazing providers there. We really just wanted to be able to work with a provider that was familiar with her diagnosis. And so we were able to team work with some of providers that were across the country without travel needed. Again, working with our general practitioner, and our genetics providers here locally. For me, I think that was a big opportunity for us. And while our situation is very unique, obviously, to some families, especially families when we think telegenetics, I think a lot of us think of families in rural areas, families without access to quality health care. We did definitely have that access. We just needed more of it without having the expense of traveling across the state, across the country, and disrupting her everyday routine to be able to access that care. So.
Okay. Thank you, Alisa. And Ashley?
For me, it was living in a rural area and not having access to all the medical necessities and medical care providers from my sons that I was needing to access. And so telegenetics and telehealth was actually very helpful for myself. And it was I was able to utilize it in my own home and be able to access it to be able to meet and meet the needs of my children. I'm gonna keep it a little brief and short. My little guy is a little warmed up this afternoon.
He's having a tough time. It's okay. Thank you for sharing, Ashley. And so, just as more and more families are utilizing, telehealth and telegenetics, what advice would you give a family who is interested in telegenetics? What would you say to them? And I'll start with you, Alisa.
I think families that are curious about it, or interested in it, I think especially families that I speak to, a lot of times the biggest concerns I hear from families are either, there's a long wait list to get in to see somebody, or it's really just there's a lack of providers in their area. I think for them, this is a great option for them to explore. I think working with their pediatrician's office to see how that, if they're not already linked up with a genetics practice, to see what exactly is available for them and to start there. I think once you kind of start asking the questions, I think a little bit the information comes to you. I do recognize that I'm kind of one of those parents that are able to access, again, the care that my child needs. However, I do know that there are parents that aren't sure what questions to even ask. And those are the parents that I really think something, especially with telehealth and telegenetics, would be beneficial to. A lot of times, especially when you're handed a new diagnosis for a child, or if you're in the process of exploring what that diagnosis may be, it's very overwhelming. You're constantly going, you're torn in several different directions. It might be, depending on the age of your child, you're either doing early intervention services, you're in therapy sessions, you're possibly working with the school district, you're obviously very close to your pediatrician office and your medical providers. Having an option where you aren't traveling, where it is more convenient for you as a parent to be able to meet the needs of your child, I think that's an exceptional benefit to this. I think that parents, sometimes I think parents just, again, like I mentioned before, they just don't know what questions to ask. And I think that being able to have just putting it out there, like, hey, what options are available to me if I'm not able to travel, or if there are not providers close by.
Thank you, Alisa. Ashley, did you have something you wanted to share? Just with advice that you would give to families?
I would just say, feel comfortable and try to, if possible, kind of think of maybe some things that might strike your mind, or some questions that you may feel even after initial appointment, that might come to you that you might have forgotten in an initial appointment and so on, and just be able to openly ask those questions to your providers and share those, and just, jot those few things down, be able to share them, ask those questions. And there's never a wrong question to ask your provider, and just to be able to communicate with them and feel comfortable and confident in doing so.
Okay. Thank you, Ashley. So the final question that I'm going to ask both of you, you both worked extremely hard on developing the telegenetics, the tele-what infographic. And so I wanted you all to share your perspective on why you thought it was important, how you came up with the name. I know often people are curious about that. And each of the different parts that exist within that infographic.
So for me, I think just, again, not knowing, I'm 11 years in, there's still questions that I'm not sure what to ask. There's a lot of things that I'm not sure of. I hear something and I'm constantly writing things down or Googling to see what that actually means. I think from a parent perspective, having an infographic like this, it will hopefully be shared over multiple media outlets, whether it's social media, whether it's on a provider's website, whether it's something that's sitting in the office, hanging on the wall while you're waiting for a visit. I think there's a lot of opportunities to give this. It's kind of like the elevator speech of telegenetics. It gives parents an idea of hearing, like, this when I hear that word telegenetics, like we mentioned, and so kind of going back to your question about the name, tele-what, a lot of times parents, I'll say, oh, have you used telehealth or telegenetics? And a lot of them are like, well, no, what is that? Tell me about it. I think this is a great snapshot to kind of pull the parent in to kind of see, okay, this is what's available to my family. This is what's available to me as a parent. This is what's available. These are the things that kind of will spark some of those questions for families to then bring to their provider. I think it also helps the provider open the dialogue with parents. Some parents, especially that maybe are frequent no-shows, frequent reschedulers. I think this is a great way to kind of let them know, hey, I know life is hard, especially obviously right now, none of us are going anywhere. But hopefully when things return to normal, we can say to them, I understand that this is difficult for you to come to this appointment, and it's been rescheduled 3 or 4 times now. We also know how crucial it is to keep those appointments if they're 6 months to a year out. How much can change in that short amount of time. So I think giving parents just another little reassurance that, like, hey, this is another option for you, because we want your child to be successful. We know that includes, you being a part of this team. So I'm excited about the infographic. I think that, I think we could have made this into a book with as much information as we wanted to share.
Absolutely.
However, that's not what the goal was. Was it really truly just to be kind of like a little snapshot to get parents excited about it and see what it is.
Thank you, Alisa. Any final comments you wanted to share, Ashley, on the infographic?
I think the tele-what keeps the conversation going for both ends, not only just for families, but for providers as well. That what, poses openings for all kinds of questions and comments, and just keeps that dialogue open. And so I'm just really excited about the catchiness of it. And I think that it's going to pique a lot of interest for families, not only families, but providers as well too, to come on board, to be open to wanting to get more involved and be involved in opening up more opportunities and pathways for families, and being accessible to everyone.
Okay. Well, thank you, Alisa and Ashley. And again, your commentary has generated some questions, so we'll come back to you momentarily. But I appreciate you participating and all of your work on this project to date. It has been truly valuable to help understand the family perspective, and in order to help develop something that's for families by families. And so we're going to shift to Maria Isabel Frankenberg. She's my colleague at Family Voices. And so we'll turn it over to her.
Great, thank you so much. It is really great to hear everybody's perspective. And so I have to say that most of what I was going to talk about has been already touched on and talked about in some really great depth by Joann and by Alisa as well. So that's really heartening that it's becoming that considerations for underserved populations are now becoming mainstream, whereas we used to have a portion of a webinar or something to talk about it. It is now part of the way we do work. But the one question that I like to ask is regarding disproportionality. So disproportionality is what tells us if we're really doing the job of reaching out to every population in our area. And so when we're thinking about a brick and mortar office, I think about neighborhood and city and state and region. So do the people in your hospital, in your exam room, do they look the same as the people that you're seeing around the neighborhood? So here for telegenetics, I would ask the same question. Do the people on your screen look the same as the people in your waiting room? Slide, please. And so as Joann and Alissa have already mentioned, there are aspects to consider, and I'm not going to belabor the point because I think they've been very well talked about. We're talking about access to Wi-Fi, access to online, and you know, whether it's a tablet and everything that has been talked about in the past, as well as who's getting the message really. So when we're talking about the appointments that you already have scheduled, how are you going about deciding who you're going to be able to see via telemedicine, and who are you going to have to keep putting off? Is that a matter of, like Joann was explaining, you had a patient that spoke Arabic, and no one thought about, oh, well, wait, we haven't translated the message to reach out to them to let them know what's going on. So these are the small steps that become part of a procedure. You know, when we make a procedure, when we make it a habit to think about other populations whose English, whose language is not, first language is not English, or they're English language learners, then what are those things that we need to be thinking about now as telemedicine is becoming something that is more and more important because of COVID. Now we're using it. Before it was optional. Now we have to use it. So who's getting the message? How are we delivering the message? Are the same ways that we deliver the message to people who are English language learners? Is it going to be the same way from the other patients? Do we use different media like WhatsApp, networks like cultural brokers? What are we using? So next slide, please. So how does it sound? Meaning, again, availability of interpreter services. And that was one question that we got earlier this week. Is there some sort of centralized number that families can call statewide, region-wide, to access interpreters for appointments? And the answer to that, to date, is no. And we're hoping that the awareness of disparities that the COVID crisis has brought will bring us closer to an answer to that specific question, because we know for a fact now that interpreters are important. Again, I'm not going to make the same points that were so well made by Joann before, Dr. Bodurtha before. But there are some hospitals who have a very well thought out system to ensure that everyone has an interpreter. And then there are places because of where they are located, or because of the languages that the specific groups speak, that don't have access to interpreters. And furthermore, that don't have access to interpreters that are trained in genetics, which we know is a very specific topic. So what happens there? So things get a little bit more gray, right? Before, you know, the purest interpreter theory is we're going to have an interpreter who is trained, and furthermore, who is trained in the specific subject or topic at hand. But then does it become, if you don't have that, does the decision become, well, do we provide the service for this family who has been on the waiting list for so long, or do we make them wait until the crisis is over? So where do we go? Do we ask them to bring an interpreter? And we all know of cases where people are being asked to bring their own interpreter, quote unquote. Might be a neighbor whom they perceive that can speak English well, or a spouse whom they, again, perceive that they speak English better than they do. And so we're left in really, really a tough place to make those decisions. So if you are in one of those tough places making decisions, the Family Center is here. So is the network of Family Voices. And as you know, we're national, and each of the Family Voices has access to, at the very least, technical assistance on how to avail their families with interpreting services. So please feel free to reach out to us. And then we talked about hospital systems. Dr. Bodurtha talked about the hospital systems. Usually they're very able and great to do what they do. And then finally, what I mentioned briefly, cultural liaisons. Again, every family-to-family health information center in every state has, if not a cultural liaison for the specific populations that live in their states, they have access, again, to the national network where we'll be able to support them to provide some sort of assistance in accessing accessing interpreters, or figuring out how to create a network of interpreters or cultural liaisons. So I hope this is helpful. Thank you.
Yeah, thank you so much, Maria. This really sets up my next slide really well, which is, as you just said, how the Family Center can help. So aside from what Maria mentioned, or I guess including what Maria mentioned, we're really well connected with the genetics providers and public health professionals throughout the country. So if you have questions or requests, we can answer them or put you in touch with someone who can. Not just for telehealth and telegenetics, but really other information about genetics, health, and navigating the healthcare system. In some cases, it may be helpful to get in touch with your regional genetics network, whether you're seeking genetics providers in your area or you want to find ways to become more involved by providing your perspective on genetic services. The Family Center can really help to make those connections. So we encourage you to reach out, and we're there to support partnership between the regional genetics networks, families, and family-led organizations. The Family Center is also working, as I mentioned, with 2 organizations that are already working with families directly, Parent to Parent USA, Family Voices. Our team can also help link with the state family health information centers that Maria mentioned. Parent to Parent also has groups state by state, which can help you navigate the healthcare system. We also have a number of educational materials, so webinars like this, infographics, educational websites like diseaseinfosearch.org, genesandlife.org, the Advocacy Atlas. We really encourage you to take a look at those available resources. And as I've been mentioning, we'll be sharing those after this meeting. I did want to highlight really quickly before we jump into questions. I know we've only got a couple minutes here, but we did create guides for each of the regions that we've mentioned that provide families and providers with information about what these various family-led organizations are. So really these family-led organizations that exist to support children and youth with special healthcare needs, such as Family Voices, Parent to Parent USA, the National Federation of Families for Children's Mental Health, and the Center for Parent Information and Resources. So we'll be sharing a link to these regional guides, which we encourage you all to take a look at. And I did want to encourage you, if you have any questions, to make sure you include those in the chat. I'm going to go start running through these, but really appreciate everyone who's been able to attend today, and thanks for the questions that have come through so far. So the first one I think would be good for Alissa or Joann to answer, but does access depend on whether or not your insurance covers an appointment by telehealth? And are you finding insurance relaxing requirements, including telehealth?
I'll go ahead for here. Probably the biggest restriction is actually still where I have a license, and all, because we do still operate within, you need to be a doctor who's licensed or a genetic counselor who has privileges, those kinds of things. And so insurance has become much more flexible, but there are still issues across state lines, and that I would say more refers to licensing, except to the best of my knowledge, and Alissa may have some update on this, we still have to get single case reviews for out-of-state Medicaid patients, but I haven't seen anything in the past 2 days on that. We're used to doing that anyway and all, but I don't know that Medicaid has made a cross-state line thing, but insurance doesn't seem to be, the commercial insurers don't seem to be as much of an issue, but I have to have a license, still, and the compact to have us that we could have national licenses like nurses do, I think it will probably go forward, and states, neighboring states have made it easier to get what would be considered temporary licenses. But I still need to see somebody, if you're, at home in a state where I don't have a license, that still is potentially a problem. We're working on it though. Alissa?
Yeah, I mean, it used to be the case for sure that there were some people that were insured by whatever the insurer were, whether it's Medicare, state Medicaid, or a private insurer, that didn't cover the type of telehealth that the genetics provider was offering for one reason or another. There are circumstances under which the patient can opt to pay for that service if they still desire it, even though the insurance doesn't want to cover it. I often find, though, that the genetics clinics try to set up their telegenetics effort so that their whole population is eligible under the model they set up. So they try to, from the beginning, to make the telegenetics clinic run in a way that most, if not all, of their patients would be eligible. And yes, the insurance rules have been relaxed tremendously over the past month, for sure.
Great, thank you both. This next question is, I think, specific to what Joann was talking about. We have someone asking, with Polycom, is the interpreter on video as well?
So long as, there's not a internet connection, yes, that's the way we do it, is that I would be able to see they have to have their, their camera on, but so long as they, we have a check system for Polycom in advance. So, before any, telegenetics visit, I actually go through a little thing where I clap my hands and look, in the camera to see that it's all working and that Polycom is working. If we're, using a live interpreter, that we're not having to fall back to the phone or something like that. Yes, they would be on as well. But I can't speak to how every center is doing it.
Excellent, thank you very much. And I got one more for both of you, Joann and Alissa again. Is there an option to access telehealth appointments at a flat fee payment if not covered by insurance?
Certainly, again, and Alissa knows the region more broadly, because she's really our telegenetics resource for our HRSA DIMAC region. Some have set those up, as flat fee services, say some for genetic counseling, et cetera. That's not what we've done. We still kind of follow billing rules of how much time we give and what % is spent on counseling and that sort of thing. And, there are codes then specific for those, categories for telehealth, as well as now telephone and all. And again, what will happen, hopefully as we come out of this, there'll be still some flexibility around those things. But again, we don't have perfect ability to predict. But we have still maintained that it's, what I'd call it is based on the quantity of the service, if that makes sense in some way, by minutes or time you're spending, or, the depth and complexity of it.
Sure.
Yeah, I see both. Sometimes a hospital or clinic setting will allow a patient to pay out of pocket if for whatever reason they're not eligible for insurance coverage for the telegenetics visit, even though some other part of the patient population is. So sometimes hospitals will do that, or, medical centers. There are also sort of these independent companies that offer a lot of times genetic counseling services. Less frequently it's seeing a physician geneticist, but sometimes that aren't affiliated with a hospital system. So there's both sort of the traditional types of medical centers that you might think about patients being referred to for an in-person appointment that can sometimes have the flexibility of letting patients pay out of pocket if their insurance won't cover it, as well as these more independent companies that offer genetic services.
And I should probably add, I again, every hospital or system center may be different, but Hopkins, I think, had done over the past 2 years probably I would say, a much better job of having, sort of more people who could do financial assistance reviews ahead of time. I guess the challenge is, I'm not sure whether those folks, some of whom were social workers, some of whom were business office people, haven't been redirected right now to other things. So it might be a harder time to get that kind of, in-depth discussion and review before a visit. And again, those services have been beefed up, but I'm afraid maybe some of those folks have been redirected to other things because, the unified command, I mean, we're being redeployed to other areas and that sort of thing as well.
Excellent. Well, I think we've addressed all the questions that we got in the chat. Really appreciate everyone who asked a question or included a comment. And again, thanks everyone for their time. This was a really great discussion. I will be circulating, as I said, the slides, the recording and evaluation, the infographic, as well as the references that we've shared. Feel free to reach out if you have any questions or comments, and we hope everyone enjoys the weekend and has a great afternoon.
Thanks for the opportunity, and be well and safe and healthy.
Thank you, Joann and Alissa and Alisa and Ashley. We appreciate it.
Yeah, thanks everyone.
Thank you.